Hi, my name is Claire Farrugia and I'm a researcher at Arches, the Australian Research Centre in Sex, Health and Society at La Trobe. And I'm speaking to you today from my house, where I've been for about 2 months now. And I guess, like so many of us, have had a sense of normalcy and routine and connectedness with friends and family totally disrupted. Let alone a sense of assessing whether it's safe to go out and where and with whom. And I wanted to use a room of one's own today to talk about the fact that this isn't an entirely new way of being for everyone. This Sunday is Homophobia, the International Day against homophobia, biphobia, intersexism and transphobia. And it's a real time to think about the ways that LGBTIQ people, to differing degrees and in differing ways, face exclusion, isolation, also a sense of assessing whether they're safe to be inside the home or outside the home, just in their everyday lives, and under, so-called normal circumstances. So it's also a good time to think about what this period of time and what COVID-19, the impacts of this period of time are having on these communities. Because we know that LGBTIQ people have health disparities that can influence disease outcomes. And at the level of health service and things like coroner's reports, for example, we don't collect data on LGBTI identities. So it is difficult to say, at least in the short term, what the health impacts are. But we do know that also LGBTIQ people are less likely to access healthcare, and particularly if they don't feel safe. And they don't feel safe for many good reasons, reporting higher incidences of stigma and discrimination. But on a social level, we also know that during this period of time, things like isolation and distancing, they impact on our well-being and our mental health. And the exact shape of these effects we don't know yet, but we do know that connection to community, things like peer support, they're really important protective factors that help LGBT people prevent kind of ill mental or physical health. Of course, we've also seen some really amazing examples of online solidarity and connection with, informal film festivals I've seen, and Bring the Club to the lounge room and dance classes. And, for some LGBT queer communities, experiences of solidarity during pandemics is not new, and in many ways is happening under this period of time. But a room of one's own was also about having the room and the actual means to use your own voice. And I think, some gay men and some, lesbian cisgendered women will also have that sorted. But also it's important to reflect on the most marginalised within LGBTIQ communities, the people seeking asylum at this period of time, or with, refugee status that doesn't allow them to access healthcare or welfare or employment opportunities. And I guess more broadly, who is the current downturn in employment disproportionately impacting? Who are the people that don't have the means to have their own room and to have their own voice during this period of time? And these are questions that are also really, I think, important to ask, to consider how homophobia, biphobia, intersexism, transphobia shape the health of our communities. So now go online and actually check out the events that are being planned for Homophobia.